Jilasu Tikesisoni. My name is Janar Siliboy. I'm from Eskizoni Mi'kmaq Nation, or First Nation. This is where I grew up. This is where I learned my language. And this is where the Aboriginal Children's Hurt and Healing Initiative story began with the IWK Health Center and with Dalhousie University as well.
About 10 years ago, I was working with the complex pain team here at the IWK Hospital. And so we noticed that we weren't seeing many First Nations children and youth referred to our clinic. Estimated maybe 2 out of 800 referrals were First Nations kids, and wondered why.
They wanted to understand from a cultural perspective and from a Mi'kmaq perspective how it is that we can understand what pain and hurt means. Also to understand how it's expressed by our children.
Within the Mi'kmaq language, there's certain words that exist, but there's certain words that don't exist. For example, using the word pain doesn't exist in the Mi'kmaq language. They refer to where they hurt and where the pain is within their body. You can understand why there would be a disconnect in the communication that exists between healthcare providers and our Indigenous or Mi'kmaq people.
We know that health is not just that physical cut that you have, but that whole context of mind, body, spirit, or mental, spiritual, physical, and emotional. They're all interconnected, and you can't separate one without the other. We know that from our cultural perspectives. We know that those are children that express that way.
When we decided to use the artwork as a possible venue or medium for them to share what they were feeling, we thought that that might be an opportunity for them to share their perspectives in a different way. So we had a circle conversation with each of the groups with Alan Siliboy, and interestingly enough, in the conversation sessions, they only talked about physical pain.
I had dental pain, or I had a stomach ache. And then Alan had told them or asked them, could we go and sit down and start drawing what this pain looks like to you? And their narratives, along with their art pieces, told a dramatic story about the emotional aspects of pain and hurt. So after we just had a conversation with the kids that talked about physical pain, there was an overabundance of expressions of emotional pain and mental pain. To them, pain is pain.
My father was a residential school survivor, and so I'm a descendant as well of residential schools. All of that trauma and hurt and pain really has done significant harm to our communities.
They have been socialized to kind of mute their pain or suppress their pain as a way of coping with it. The art revealed that these youth are feeling a lot of emotional pain as represented in their artwork, which was in direct contrast to the healthcare utilization data, which showed they were significantly less likely to receive a mental health diagnosis when we compared them to a non-Aboriginal group. So I think it was a validation for us on many levels that art is an excellent medium to help youth sort of express themselves, but also as a research method to help us collect that information.
It was right there. It was right in front of us. The research showed us with those kids that it's not just physical pain, and we can't look at it just from a physical perspective. It's emotional, mental, and spiritual as well. What
we'd like to do is help health professionals understand that this is the way that they may be when they present in an emergency department or a physician's or a nurse practitioner's office.
That understanding is very important, because then we had to switch gears a little bit and not just ask about physical pain. We had to understand what their emotional pain is as well.
I think it really taught us how important that cultural safety is, to create that safe space for youth to be able to share their perspectives in a way that is meaningful and reflects a community-centered approach.
And we have to make sure that those objectives that we have of children right now that are being born have better outcomes than the children that were coming out 10 years ago, 15 years ago, 20 years ago.